Hello, my name is Dr. Brandon Bosque. I'm a board-certified podiatrist and certified wound specialist physician. I'm a medical science liaison for Aroa Biosurgery.
And I'm Dr. Richard Kaufman. I'm a practicing podiatric surgeon and certified wound specialist physician in Atlanta, Georgia.
Dr. Kaufman, we had the opportunity to collaborate with a few physicians across the country in a multi-center retrospective larger case series. So we looked at 50 cases, lower extremity wounds that were reconstructed with Myriad Matrix or Myriad morsels. So for our audience, the primary endpoints was the median time to 100% granulation. A lot of these wounds have exposed bone, exposed tendon, exposed hardware. So we wanted to capture when that was covered with a good, manageable tissue so that you can finalize that structure.
Especially when you have ones with exposed structures such as bone or tendon or even hardware. The number one thing is getting coverage over that, so then eventually you could either skin graft it to primarily close it, or let it heal by secondary intention if they're not a candidate for that. So both Myriad and the morselized version has been a wonderful product to allow me to get to that point where essentially the wound is easy, right? So it's me to prevent doing some technically complex procedures such as muscle flaps, which have their own inherent problems like flap failure and necrosis, etc.
When we sat down to design this study, we purposely wanted to make sure that we included those complex patients that have cancer and circulation problems. When we included the N of 50, we had a whole range, not just looking at diabetic foot ulcers or venous leg ulcers. We looked at surgical dehiscence, deep partial thickness burns, traumatic wounds, pyoderma gangrenosum. I know you had a patient that had undergone a soft tissue reconstruction with pyoderma. And then also, really interestingly, we saw about 54% of the patients in the study had underlying osteomyelitis. Getting that coverage of those exposed vital structures, getting the granulation tissue to the level of the adjacent skin. And what we found with at the N of 50, we achieved that at about 26 days on average.
Every patient's different and every situation is different. The more complex, and I would say like any wound that's like a pyoderma or something like that, there's a lot of medical management that has to be done before, right? Exactly. So that might skew it a little bit. I think 26 days in order to get granulation tissue, I mean, that's amazing. I mean, like, I see wounds all the time that have been present for, 6 months, a year, 2 years sometimes. Sure. So in order to get granulation tissue in that short a period of time, I think is fantastic.
I would agree. So now let's talk about that all-important time to overall closure. We saw that they were healing on average about 13.7 weeks. And again, that's pretty, at least for me, it's pretty impressive when you have the complexity of these wounds, comorbidities, exposed structures. What's really interesting, and I think so important in terms of minimizing the amount of time in the operating room for the patient, and of course that all-important cost and value proposition for the healthcare system, is that there was a mean of one application to achieve that level of granulation tissue.
I will say that is one of my favorite things about this product, period. Even if you have like block time in your hospital, bringing someone to the OR is an ordeal.
I'm a big negative pressure wound therapy guy myself, so it's great that this product works synergistically. You can see about 36% of the patients that we included in this study utilize negative pressure, but we had some of our co-authors that said, I actually utilized this and I felt like I didn't need negative pressure, which is an interesting perspective as well. So it gives you that flexibility that you can use either one. Again, it was an absolute pleasure chatting about our study. We're really excited for it to be published. Wonderful to collaborate with you and our other co-authors as well, and always a pleasure seeing you. Thank you so much for your time today.
Yeah, sure thing.